Dr. Burak Ersen.
Yes.
Is that how your French customers or patients call you?
I think so, but I think they...
You speak French, don't you?
A little bit, I mean.
What else?
In Turkish, we said just as enough to do my job, you see. That's how I
Say
know
something
my
in French to me.
Oh, okay.
Impress me as the world's most famous body
Je
shaper.
comprends un peu français.
Oh! I don't even know what you said. I hope it's something good.
I think it's enough just to say bonjour, ça va, and then
Okay.
you don't need to say. And you need to know a little bit Arabic. So.
There's enough Arabic-speaking people in France.
That's right.
You speak Swedish as well, don't you?
I think I like to believe I am, but yes, I think my Swedish is a little bit.
Well, for
rusty
your
at the moment.
Swedish potential watching people or my 0 followers, say something or say good morning in Swedish.
God morgon.
That-
Jag vet svenska lite. My Swedish is better than my
Look,
French.
guys, this is Dr. Burak Ersen. Okay, is clearly a gentleman, very well educated, young man.
Casual wearing.
Casual wearing. Show us your slippers. Straight out of surgery.
That's right. I completed my surgery.
Yes.
And I directly run to you.
Thank
to do
you.
This podcast.
Thank you. You're very well known, of course, body shaper in Turkey, a plastic surgeon, a reconstructive surgeon as well, and I am pleased that I am part of your journey since last 4-5 years now.
I think this is our 6th now. In
Wow.
September,
Wow.
we will start our 6th.
I didn't want nobody to know my age, but yes, indeed, it has been pleasure for me, and you have transformed thousands of people's lives in coming from all over the world. Since this is our first chat in this environment, let us get to know you a little bit. From the birth of you, a little Burak. And let's get into
40 years.
40
years back.
40 years.
It was a sunny evening.
My father decided.
My father was a little bit drunk. Okay, first of all, thank you very much. So I'm gonna act like I know this job better than you and answer your questions.
Please do.
But actually, you know everything better than me about the details of what we are doing in here. I'm 40 years old, and I was born in a peripheral city in Turkey. I spent since my father is a soldier, I spent traveling a lot Turkey during my educational career. Elementary school somewhere else, high school somewhere else, childhood somewhere else. So basically, I've seen everywhere in Turkey. But my medical school, I won the exam and I came to Istanbul. Since my medical school, it's been 20 years. Istanbul is my home.
Yes.
And as I just, like you mentioned, for the last 6 years, Clinichub is my home.
Exactly.
This is what it is.
Exactly. How did you choose to become a plastic surgeon?
I think...
Or tell us the process of the medical school and medical system in Turkey, because there's this debate in the world. Supposedly, the European educated or American educated or there's this perception, is the surgeon good enough? Mm-hmm. So I think the world needs to know how tough the medical school system in Turkey is. And on top of this, the process of, after the school, there's a process that you have to join. It's like an obligatory army service that you have to do your obligatory service for the government. Mm-hmm. And you naturally gain such experience before you guys go on and set up your own enterprises. So tell us this process as well, so the world understands the mind of a plastic surgeon and preparation, the system's preparation of a plastic surgeon.
Of course, since we are doing aesthetic surgeries basically every day, it's really easy to assume that we are only doing aesthetic surgeries. Actually, our education is really wide. For example, take me. I started my plastic surgery career as a microsurgeon. I worked for burn centers. I did reconstructive surgeries, a lot of hand surgeries, my craniofacial traumas and everything. Maybe for my first 6-7 years, I was heavily working on reconstructive surgery and microsurgery. And after that, life happened and I switched my journey. But it's important to distinguish that it is impossible to do aesthetic surgery without the knowledge of reconstructive surgery.
Of course.
Because you have to know how to repair something when you break it down. That's the most important thing, and that subject brings us to our medical education, because like all over the world, the medical school prepares us to be a family doctor, GPs, but in Turkey, all doctors we enter an exam, and only 5 to 10% of doctors are able to get in specialties.
Okay.
And I think also it's also easy to assume that plastic surgery is one of the top ones. So you have
Yes.
to study and work a lot to be a plastic surgeon, just to get the plastic surgery education.
That 2 to 3%,
That's
maybe
right.
even 1% of the specialties are
I
plastic surgeon. Can I say?
I think my rate was, I was the 500 something like
Top
that.
500.
Top 500. So I entered the plastic.
All hail Burak.
No, we have better people than me.
No, well done. Well done.
But you see, that's another chapter, because earning that exam, earning that right, has nothing to do with your plastic surgery education.
Mm-hmm.
That one chapter ends, another chapter starts when you start plastic surgery education as a resident, because in the first chapter, I'm talking about entering the exam. Everything is theoretical. You need to study really hard, and it's more than a mental process. Just to being hardworking is not enough. You should be stubborn. You should be patient, because I think it's the third hardest exam in the earth, or something like that. It's a really hard exam. After that, everything is physical and academical. So 2 different words. The plastic surgery, plastic, aesthetic, and reconstructive surgery education is 2 things. First, you are, of course, educating your thing. You have mentors and everyone. You are gaining grades. It takes 6 years. But in the same time, you have to work. You have to do surgery. So that period is really intense.
Yes. So all that process brings you to, can you make my bum bigger?
I like to think I can. That's the whole process,
Okay.
right, Yosef?
So I know, because I've been part of your journey, but tell me your journey to European and world patients arriving to Turkey and demanding body shaping, and especially, let's call, Brazilian butt lift. How did you feel when you performed your first Brazilian butt lift surgery? After all that education, hardship.
I mean, I think I should thank to my wife.
That's good.
You should
My
hear this.
mom, my father.
I love you. Thank you. Okay, the thing is that
Okay.
after my obligatory service, my wife my wife wanted to raise our kids in Istanbul, because there are more opportunities in here. And actually, then we were looking for opportunities, and I have met you.
Yes, we have.
and your
yes,
partner.
we have.
and your partner.
Let me look at the horizon a little bit. Yes, we have.
That's right. And yes, it was 6 years ago. I think at that time, body reshaping surgeries was new. Even
Yes.
BBL was new.
For Turkey, it was, because we are talking about 2018.
That's right.
With you. So it was indeed, because I started in 2016-17 before we joined together. In the last vlog I mentioned also, it was for me introducing Turkey.
That's right.
Not introducing a surgeon initially. It was introducing Turkey as an option to Dominican Republic, as an option to Colombia. A little bit, few people were in Belgium, and naturally Brazil. So I was introducing for 2 years Clinichub as a company that offers a very similar quality jobs, in fact, if not better quality jobs than all these countries I just mentioned, and slowly raised awareness of plastic surgeries. I mean, elective surgeries can be performed in Turkey. So obviously, naturally, hair transplants had already started 2010, 11, 12, but not as much as now. You know, it's, as you know, we are called Turkish Airlines. Even Turkish Airlines are called. So, but from that came into naturally your subject, which we initially talked about. You are very well known, especially on certain BMI or high BMI patients. Not many people, maybe I think there's only 3 or 4 of you in the world that tackles these
Challenging cases.
challenging cases. This is not illness. I mean, how do you call these cases? Are they illness?
Oh no, of course they're not illness. I mean, I think first of all we should tell that I don't know it's right to say, but no one needs these surgeries.
Thank you. You're right. This is elective surgery.
These are elective surgeries, but it's something to feel better because in here it is maybe impossible to prepare someone to a new life because everything will change and it's impossible to comprehend what kind of changes will happen in the future. But the effect of this surgery creates a great baseline for a new life. Everything becomes better because I mean I was overweight also. I lost weight and
yes, I know you lost 9 kg in the last
right.
how many days?
I'm in the last 45 days. So
Let's get your chamomile tea.
yes, thank you.
You drink chamomile, don't you?
That's right.
This is Turkish
this
tea,
is
by the
easy.
way. Okay. Relax. I see you more relaxed now.
Thank you. I do.
How many chamomile teas a day?
Actually, this is my second, but
Oh, no, don't drink too much, Burak.
I'm supposed to drink one.
Don't drink too much.
That's right. So,
yes.
About that, it's going to create a new life, new opportunities. Living a heavy life is hard. I mean, standing up is hard. And after reshaping, after taking all that immobility away from life, is going to make everything easier. So this is maybe the biggest advantage we can provide for our patients. Transforming their bodies actually is transforming their lives.
Bravo.
To be
the mental readiness for the new challenges. What I have seen during all these years, especially body shaping and the rhinoplasty surgeries, which we are heavily involved with, the mental readiness for new challenges on a successful surgery after surgery is amazing. You have been part of, is it safe to say that you are performing about 500 surgeries a year?
I think so. I mean, it was even more a couple of years ago. Now we are
just as an average, average.
But yes, I think 400, 500 cases per year. But you see, my surgeries are usually a combination of 3 surgeries.
Yes, that is a very important point because
I think it's fair to say that 500 patients.
I think it's known as the mummy makeover.
That's right.
I think you are the king of mummy makeover in this part of the world. Can I say that? I know you're very.
I will say I'm experienced more than most. But you see, because about the mummy maker, it's all about the timing. You need to reduce the duration of the surgery, because when you manage to reduce the duration of the surgery, you are going to reduce all possible complication risks. The recovery will be better. As I told you, I would say going back to life will be faster.
Okay.
So
okay, it's good point that we came to. I mean, we are talking about combination of surgeries, which also brings an idea to people who is watching this or is going to watch the clips of this. Are your patients over 30, over 35, or over 40, and people who have already given birth or lost weight or in the process of little bit chubby, want a shape, but do you also, I mean, because I know your surgery schedule, it's mostly combination of 2 or 3.
That's right.
This is what people want you to do to them. And can you say the age group that chooses you, or the sort of BMI group that chooses you? And let's get into this combination of mummy makeover. What is mummy makeover, for example? It's a very good term, by the way.
That's right.
Why there is no daddy makeover, for example?
I mean, mummy makeover refers the surgeries patients willing to have after they finish that period of pregnancy, being a mother and everything. Because, as you know, those changes usually happens after birth. You usually gain weight, and it becomes, because of life, it becomes hard for you to get rid of that weight again. So the tummy gets bigger, the breasts, they go bigger, and sometimes they go saggier. And basically, a combination of those surgeries, a tummy surgery, a breast surgery, sometimes hip and gluteal region surgery. A combination of these surgeries are called mummy makeover surgery. It first started with mummies, with mothers. That's why we are calling it mummy makeover. Actually, it's the easier, and also it's easy for us. But actually, if you gain weight a lot, again because of life or different things, there is no age for that. If you have a problem with your tummy, I mean generally for your upper trunk, your breasts, and your gluteal region, your hips, combination of these surgeries are called basically mummy makeover surgeries. Okay?
Great, great.
That's what.
So sometimes it can be tummy is
tuck
always
and
there,
breast lift.
tummy tuck and breast lift. Sometimes it can be tummy tuck, liposuction, and breast reduction.
It doesn't have to be tummy tuck. Liposuction. And
Or even that, bravo. Yeah.
Liposuction and breast augmentation, for example. This is also a mummy makeover surgery, technically.
How do you, I mean, most of the clients or most of the patients, the clients delete that because they are not clients, they are patients. And most of the patients, they never want abdominoplasty, which is the tummy tuck. Nobody wants a scar from hip to hip. And there has been cases that you have performed what the patient wants because this is what the obligatory, isn't it, for a surgeon to do what the patient wants.
Our biggest obligation is to listen and decide together.
Sometimes they don't listen. So what happens when they don't listen?
Okay, so
which means we talk together, we decide together, but don't listen to me.
That's right. So if a surgeon, not we, if a surgeon advises you to have a tummy tuck, you must have tummy tuck. The reason is that, let's say you refuse it and you had the liposuction. It's highly possible, since this is what we do for a living, it is highly possible if you don't get the tummy tuck now, 6 months later, you will be destined to have that tummy tuck because your tummy will look disfigured. And if you have that tummy tuck 6 months later...
It looks like that because you remove all the fat under the skin.
That's right, and you will end up having saggy skin, and that skin will not retract enough. So let's say 6 months later, 1 year later, you came back to me to have the tummy tuck. You told me that, yes, doctor, you were right. I should have done the tummy tuck, but now I regret. I want to have tummy tuck now. In the second session, you had liposuction before. That means the risks, complication possibilities in the second surgery will be higher compared to first surgery.
Thank you. We want to talk about these actually because we have many patients also visits us having had surgeries before, either sometimes with you or sometimes with another surgeon, and we need to talk about that second and third surgeries and why there is more prone to
liposuction.
There is more risk compared to the number one surgery,
of course.
And what is the risk and things like that. If we can,
it's also important to underline that I prefer liposuction too. It makes my job easier.
Of course, you don't need to cut.
I mean, I want this more than my patients actually. Because small incision, just liposuction. If you are a suitable patient, it is liposuction. I'm not going to advise tummy tuck if you don't need it. However, okay, that happened in the past. Imagine 100 patients. Okay. All of them, they require tummy tuck. They are insisting on liposuction. I'm doing this explanation, what I just did to you, to all of them. And let's say I performed liposuction to all of them. 1 or 2 of them is going to retract greatly. And they are going to be right. Instead of getting tummy tuck, they get liposuction, they got liposuction, and they had perfect...
Why they retract better?
Because they have thicker skin, they have no stretch marks and things like that. They have a big tummy, but they retract greatly and they have a perfect result. And I'm sharing those pictures in my Instagram profile.
Yes, please. Please have a look at them.
But this is 1% or 2%. The remaining 98%, I was right. They require tummy tuck, they should have got tummy tuck, and they are destined to come back to me 6 months later. So this is the logic behind it. If you listen what I say, we are going to increase your chance to solve all your problem just in one session.
Bravo.
And this is what we are looking for. I want to touch my patients once and solve everything in that session. I don't want to do revisions. I don't want to treat complications. And I want this more than anyone in the world. Because this is this is my oath.
Then it brings me to ask you, how much is enough for a patient's mind? Because, we have patients, sometimes number 1, number 2, number 3, number 4, they want, and we say, okay, stop.
Okay.
I mean, for you, because you're a little bit high sucking liposuction. How do you put that in medical term? If sucking is not right, high consuming.
I like to put it like that. I don't stop until I feel satisfied. Okay.
And the medically,
of course.
Okay, talk to me about
within safe limits.
Okay,
I'm going
exactly.
to go all the way.
That's what I was trying to come to. Tell me your safe preparation of this BBL, because nowadays there's so much misleading of patients, clients around the world. Safe BBL, ultrasonic BBL. Okay, let's talk about number one, BBL. Again, everyone knows what BBL nowadays, but what BBL is, and then what is safe BBL is, what is fat melting, fat sucking, and fat purifying, and fat injection. And the way how it's injected, the techniques, under muscle, over muscle, fat embolism, these are the questions. In 2024, first question I received was 2016 when I started this business, and 2014 I still get the same questions. Rightly so, people need to ask. There's lots of material now on the internet, but still they want to hear it again and again and again from the surgeon of their choosing, which is you.
BBL is Brazilian butt lift surgery. However, it is technical term is liposculpture.
Liposculpture.
So we are sculpting your body by using your own fat. We are harvesting the fat from unwanted areas that you are, how to say, disturbed of, and putting that fat.
Let's name them those areas.
Okay, tummy.
I mean, I am your example. I am very disturbed with my big belly. Can you take this out?
I can take. I think I should advise you tummy tuck. No, I'm just kidding. Okay. There's a perfect liposuction patient. Okay.
Right, so, I am. Huh?
Yes, I can.
But I don't want no hips. Okay, not too much on the side.
You can harvest fat from anywhere as long as it is safe. And
when you say anywhere,
tummy,
arms,
shoulders,
so meaning arms here or there?
Here, above your elbows.
Okay.
Shoulders.
Also here.
Upper back.
Sides,
tummy, your back. Okay, all the way from your bra line down to your gluteal region.
Okay.
Inner thighs, like 360. Outer.
So you can do a 360 liposuction?
Not in one session, in 360, because there are technical difficulties for that.
Okay.
But it is possible.
But I think that legs, big legs, they fall under, and you also perform that surgery. Please remind me. Big legs, big calves.
Lipodem surgery.
Bravo. You also, thank you for reminding me.
It's basically liposuction.
By the way, it is, this is an illness.
That's right.
Lipodem, ladies generally, who have big legs, big, this part, calves.
Calves, thighs. Like medial,
so
medial knee.
This is a medical need plastic surgery. It can be resolved with high volume liposuction.
That's correct.
And sometimes one session, sometimes two sessions.
Post-op care. We should also stress the importance of post-op care.
Okay, I think you should talk about this after finishing this BBL. This is very important because I have seen immense amount of interest in lipodema.
That's right.
Okay.
And also, before talking about BBL again, it's also important to explain the reason, the logic of the cooperation we are doing in here, the Clinichub and the surgeons. Because what we are doing is the indoor surgery theater, but there is preparation for the surgery and there is the post-op care. And since I'm in the surgery room all the time, Clinichub is taking care everything other than surgery, the post-op care, the preparation.
It's about time you talk about Clinichub.
That's right. everything you need, fajas, massages, medication, transfer, location, everything. So this is a huge cooperation thing actually. So, and we are only we are scoring. We are the strikers, we are the forwards, but you are the goalkeeper, defense, and middle fielder. We are doing everything, giving us the pass, the ball, and we are basically scoring. So this is a cooperation. That's why it's important.
It's a team of 110 people these days. Clinichub holds to service customers coming from all around the world.
And now BBL.
now BBL.
Okay.
Again.
So this is basically we harvested your fat. There are different energy type devices, and everyone use different devices. In here, thanks to again Clinichub, we have the most advanced technology. That's why our results are so remarkable compared to our peers. First, we are using ultrasound assisted liposuction. And
please stress this out, because everybody using, and some surgeons especially who do not have enough clients, they are using this as a marketing tool. Dr. Burak has been using this for years.
I started with this. Since day one, I'm using the same devices, but the technology advanced, and every
Obviously,
time we have a new technology, you are providing those
we
technologies for us.
update the electronic needs of
That's right.
surgery.
So this is your actual, these are the unknown things. This also important to stress those stuff. So in your BBL surgery, what are harvesting fat? Number one thing we use, you know this as Vaser, but it's called ultrasound assisted liposuction device.
It's called Vaser in the world.
In the world, it's the most.
So what does Vaser do actually? People think Vaser is the liposuction.
It's not harvesting fat. It is basically melting down the soft tissue around the fat tissues,
which is under the skin.
That's right. Fat is basically like grapes. Imagine it like a branch of grape, and in grape, like there's a surface around it. The Vaser melts down the surface, the branches in between, and everything. So it is helping us inside the grape, the grape in the purest form. So basically, we melted everything around the grape, around the fat tissue with ultrasound assisted liposuction with sound energy. After that, we are using vibration assisted or power assisted liposuction.
Yes.
Which is quite different than conventional orthodox liposuction devices, because when you pull the cannula forward, it moves vibrating and three-dimensionally. So
it disturbs more fat,
and also it harvests fat evenly in a wider way. So the complications such as rippling, if skin irregularities or skin damage, blood vascularization problems and things like that, they automatically decrease.